Right now, veterans across America are facing a crisis that nobody wants to talk about. While our brave men and women who served overseas are coming home expecting the healthcare they were promised, many are discovering a system that's broken, understaffed, and honestly, drowning in red tape. But what if I told you that major changes are happening behind the scenes that could revolutionize veteran healthcare forever? Today we're diving deep into the massive overhaul happening at the Department of Veterans Affairs, and I'm going to reveal exactly how these changes could affect every veteran watching this video. Whether you're currently using VA services, know someone who is, or you're a veteran yourself, what I'm about to share will completely change how you think about veteran healthcare in America. Let's start with something most people don't understand about the VA system. The Department of Veterans Affairs isn't just one giant organization, it's actually divided into three major components that serve different purposes. You've got the Veterans Health Administration, which handles all medical care and treatment, the Veterans Benefits Administration that manages disability compensation and other benefits, and the National Cemetery Administration that oversees military burial grounds. This structure creates both opportunities and challenges. When government shutdowns occur, different parts of the VA are affected differently. The health services often continue operating because they receive advanced funding, meaning veterans can still get their medical appointments and treatments. However, other services might face delays or restrictions, creating confusion and frustration for families who depend on these benefits. So, recent political tensions have really highlighted just how vulnerable our veterans can become during budget disputes. Military families deployed overseas, well, they've expressed some pretty serious concerns about pay interruptions and benefit delays. Organizations like the Armed Services YMCA have reported increased demand for their services during these uncertain times, as families struggle to make ends meet when government funding becomes, uncertain. The challenges honestly extend beyond just funding issues. Major news outlets have started scrutinizing veteran disability benefits, publishing investigative pieces that veteran advocacy groups are calling unfair attacks on those who served. These articles, they focus heavily on cases of fraud and abuse, while largely ignoring the millions of veterans who legitimately depend on these benefits for their survival and well-being. What's particularly troubling about this media coverage is just how it paints veterans with such a broad brush. Sure, there are individuals who attempt to game the system. Every large program faces fraudulent claims, but the vast majority of veterans receiving disability benefits have earned them through genuine injuries and illnesses sustained during their service. These benefits, they're not handouts, they're compensation for sacrifices made in defense of our nation. So, this brings us to one of the most significant developments in veteran healthcare. Under previous administrations, veterans often faced, a lot of bureaucratic obstacles when trying to access care outside the VA system. Even when the law allowed for community care, the approval process was usually lengthy and complicated, forcing many veterans to wait for treatment, or, sometimes, accept substandard care. The current approach actually represents a fundamental shift in philosophy. Instead of making veterans jump through multiple hoops to prove they need outside care, the new system uses what's called best medical interest as the primary criterion. This means that if a VA doctor determines that a veteran would receive better treatment in the community, whether that's because of specialized expertise, convenience, or other factors, they can authorize that care without extensive bureaucratic review. This change addresses one of the most persistent complaints from veterans, which is inconsistency in their healthcare relationships. Many veterans report seeing different doctors for each appointment, with physicians spending more time looking at computer screens than actually connecting with their patients. In contrast, community providers often offer more personalized, relationship-based care that, honestly, many veterans find preferable. However, the solution isn't simply to abandon the VA system entirely. The VA actually excels in several areas of medical care that are particularly relevant to veterans. Prosthetics care, trauma treatment, post-traumatic stress therapy, and care for toxic exposure injuries are all areas where VA facilities often outperform community providers. These specializations exist because VA doctors and staff deal with these conditions regularly and have developed exceptional expertise. The key is creating a hybrid system that combines the best of both worlds. Veterans should have access to VA specialty care when it's superior, while also being able to choose community providers when that option better serves their needs. This flexibility recognizes that healthcare isn't one size fits all, and veterans deserve options just like any other patients. Behind the scenes, major organizational changes are streamlining how the VA operates. Years of bureaucratic buildup had created a maze of regulations and procedures that frustrated both veterans and VA staff. Doctors were spending excessive time on administrative tasks instead of treating patients. Nurses faced similar bureaucratic burdens that prevented them from focusing on care delivery. The modernization effort aims to eliminate these inefficiencies and bring VA practices into alignment with contemporary healthcare standards. This includes updating technology systems, simplifying approval processes, and giving healthcare providers more autonomy to make clinical decisions without excessive oversight. One area receiving particular attention is the recruitment and retention of quality medical professionals. The VA has historically struggled to compete with private sector salaries and working conditions, leading to high turnover rates and staffing shortages. New initiatives are addressing compensation disparities and creating more appealing work environments to attract and keep talented healthcare workers. The transformation also includes expanding mental health services, particularly suicide prevention programs. Veteran suicide rates remain tragically high, and addressing this crisis requires both immediate intervention capabilities and long-term support systems. The message being emphasized is clear: no veteran should feel alone or without resources when facing mental health challenges. Looking ahead, several factors will determine the success of these reforms. Sustained political support is crucial, since healthcare transformation really needs consistent funding and policy stability over, many years. Public understanding and support for veteran issues also plays a role, especially when media coverage might at times create negative perceptions about veteran benefit programs. The involvement of veterans themselves in leadership positions brings valuable perspective to these changes. Having decision-makers who actually understand the veteran experience firsthand helps ensure that reforms address real problems rather than just theoretical concerns identified by outside observers. For veterans currently navigating the system, the immediate message is really one of reassurance combined with realistic expectations. Healthcare services continue operating even during political disruptions, and new options are becoming available that should improve access and quality of care. However, large-scale system changes do take time to implement fully, so patience may be required as improvements roll out. The broader goal is creating a veteran healthcare system that honors the service and sacrifice of those who wore our nation's uniform. This means ensuring access to high-quality care, whether delivered through VA facilities or community providers, and eliminating bureaucratic barriers that prevent veterans from getting the treatment they need and deserve. Veterans earn these benefits through their service, and, the system should really reflect that reality by providing excellent, accessible healthcare that meets their unique needs. The current transformation efforts represent the most comprehensive attempt in years to achieve that vision, with changes designed to last well beyond any single political administration. For families of veterans, understanding these changes can help you better navigate the system and advocate for your loved ones when necessary. The key is staying informed about available options and not hesitating to ask questions or seek assistance when dealing with VA bureaucracy. The ultimate measure of success will be whether veterans receive better healthcare outcomes and feel respected and valued by the system designed to serve them. That's the standard by which these reforms should be judged, and it's what our veterans deserve after everything they've given for this country. Thank you for watching. If you found this information valuable and want to stay updated on all things related to veterans, subscribe to our channel. By hitting that subscribe button, you'll be the first to know about future updates and in-depth analyses that can help you navigate the complexities of veteran benefits and services.